we are the biggest medical device implanter in the area of cardiology. And so being the biggest, we have the biggest footprint of remote monitoring.
In the early days, we were using Excel spreadsheets. We had a small call center where agents were physically dialing a phone.
We're spending all of our time trying to figure out who is connected and who's not connected. You're spending no time actually looking at the data.
In order to scale that and add more patients or add more functionality, we just couldn't continue to do the manual processes.
The challenge that we saw is that every time we launched a new monitor, we would launch a new program and a new operations to manage that monitor. And Virtusa has really allowed us to simplify our version of doing that.
I'm responsible for the client relationship management at Virtusa. I understand the business problems that Medtronic is facing and look at what kind of solution that Virtusa can really offer to them. As a clinician, I think I get a lot of comfort by looking at this particular ecosystem.
It was a privilege to even be invited to work with Medtronic and be part of their family.
How they helped us far exceed our goals was really in just their style of partnership, I would say.
Wouldn't it be great if Virtusa could actually create a prototype of the solution that we want to pilot? Virtusa said, well, I think we could do that, and I think we could do it in 2 weeks.
I think as a team, we all came together to look at the entire roadmap, the entire vision as to what should be the outcome.
They really listened to what we needed and then started to tailor based on what solutions and systems we had available.
When we started it, we looked at a three-pronged approach.
We want to really do away with all these manual activities and come up with the dashboards which are meaningful to every stakeholder.
From a process point of view, we looked at what are all the regulatory needs because we are, end of the day, dealing with patients' primary data.
For them to come in and catch on to what we were doing and trying to accomplish in our systems that quickly was amazing in itself.
Medtronic, we have over 2.5 million patients worldwide who are monitored.
If we can't reach a patient, we can't help or support that patient.
In the area of cost, we've discovered new pockets of monitor waste along that life cycle. Really, again, just based on proactive analytics, if you will.
I think it was 3 months from when I gave the go-ahead and provided the funding to actual seeing results. It was probably less than that, 2 to 3 months.
Between where we first implemented and where we are today, we've increased the number of patients they were able to contact by about 5x.
They no longer need to be doing this laborious work. They can be focusing on things that are well suited to their skill set.
What that gave us was a scalable solution so we can continue to add new workflows, reach more patients.
Through this solution, this entire setup got automated, and so we are actually picking up the contact details of the patient from one system.
It's really clinically been proven that a patient who is connected, where their device is transmitting on a regular schedule, that their clinician is able to see that data, they have better long-term survival. They have better quality of life. They have reduced hospitalizations.
Even though we are focused on the experience of these vital stakeholders, there is a significant value back to Medtronic as well.
The solution itself has allowed us to scale without adding any additional cost or resources to the operation.
So when you think about driving down cost, building a scalable platform that allows us to consider the next monitor that's not yet launched is where this is really impactful.